Good morning, everyone. My name is Jane Paul of Medical ICU. I am co-investigator of this study, Healthcare Provider Attitudes toward the newly developed COVID-19 vaccine cross-sectional study. As ASH clinical nurses continue their magnetic journey, research plays an important role. Clinical nurses nurses can learn and develop an appreciation to research through the presentation of results and knowledge gleaned through research. In relation to this, on behalf of Yasmel Sid et al., I will be presenting the results of this study. So I will be talking about introduction, objectives, research methodology, results and discussion, and conclusion. Coronavirus disease 2019, also known as the COVID-19, was declared a global pandemic by the World Health Organization in March 2020. As the world is witnessing the epidemic of COVID-19, rapid development of effective vaccines was urgently needed. To avoid the spread of COVID-19, measures to increase the acceptance of these vaccines are critical. However, program success depends on high vaccine acceptance versus rejection rates by healthcare provider who plays a crucial role in vaccination. Vaccine hesitancy is a global threat, so scientists must focus on understanding the underlying cause of this hesitancy to fight against misinformation. Objectives of the study. The long-term solution to the COVID-19 pandemic will be a globally implemented and safe vaccination program, which will have both broad clinical and socioeconomic benefits. The vaccine must also be accepted by the public as well as the healthcare community. Considering the vaccine hesitancy as a major barrier to vaccine uptake, a high vaccine refusal rate could be significantly affect the preventive goals. In this study, we aim to assess the attitudes of healthcare providers in a tertiary private hospital toward their acceptance and intention to advocate for the newly developed COVID-19 vaccine among patients, friends, and families. Identify the possible reasons behind healthcare provider acceptance and rejection of the newly developed vaccines. Research methodology. A cross-sectional study was conducted using a questionnaire. The study was conducted in a tertiary private hospital in the East region of Saudi Arabia, where an electronic survey was distributed to all healthcare providers. All respondent employees were enrolled consecutively in the study. An ethical approval to conduct the study was obtained from ALMOOSA Hospital's Institutional Review Board. The questionnaire consisted of two sections. The first one was socio-demographic characteristics, gathering data on sex, age, education, status, years of experience, nationality, occupation, and marital status. The second one used a Likert scale to gather information on perceptions consistent of 12 items, including medical knowledge, trust in media, trust in manufacturers, and trust in policymakers and leaders. The validation test of the data collection instrument revealed an internal consistency of 72%. A score of at least 70 is considered to be a good reliability. Sample size. The sample size for our study was determined in reference to an effect size from a similar study, applying the standard categorical variable data sample equation wherein n equals C squared times PQ divided by E squared. A is the confidence level, P is the reported effect size, and E is the margin of error, expecting 99% confidence level. The optimal sample size for this study was 196, and we gathered 236 participants, which make it 37% response rate. The results and discussions. Table 1 shows the socio-demographic characteristics of the respondents. 72% of the respondents were female, 57% were aged less than 35 years old, and 80% were postgraduate degrees, wherein 32% consisted of Indian respondents. A total of 110 or 46.6% had over 10 years of experience, and most of them were nurses, 140C, 62%. And 81% of the participants trust healthcare provider for most information on vaccine. 56% of the participants accepted the vaccine, while 46% rejected, and 60% of them will advocate it. The common reasons for rejecting the vaccine are outlined in Table 2. The top 3 reasons include manufacturing company, manufacturing country, and the forced vaccination provokes hesitancy. Univariate analysis revealed that older respondents significantly accepted and advocated for the new vaccine more than the younger ones, which is 53% versus 47%, p-value of 0.03. Multivariate analysis revealed that men were significantly more likely than women to accept and advocate for the new vaccine, p-value of 0.03, as were those who had chronic illnesses, p-value 0.04. Participants with allergy were significantly less than others to accept the vaccine. The results also showed that the trust in the healthcare providers is double the trust in other influential people, as shown in Table 4. Healthcare providers, specialties, graduation degree, and years of experience showed no statistically significant differences in the acceptance rate. So, conclusion, the overall rate of acceptance among healthcare providers for a newly designed COVID-19 vaccination was average. The sex, age, presence of chronic illnesses, and allergy are significant predictors for accepting the vaccine. It is strongly recommended that healthcare providers are prepared for a science and evidence-based approach that addresses the safety and efficacy of the vaccines in the community to build and maintain public trust in the vaccine. Well-planned media and a positive, influential campaign led by healthcare providers can be used to share transparent and scientific information with the community in terms of epidemiological details, scientific facts, and methodological process of the vaccine. Senior health our policymakers and leaders in public taking the vaccine will encourage more people to accept the vaccination. Let's end my presentation. Thank you.
Laila.